Hi, I'm Dr. Larry Malerba, and welcome to the latest episode of the Materia Medica series here on the All Things Homeopathy YouTube channel. Today I'll be talking about the homeopathic remedy opium, which is made from the seed pod of the flower of the opium poppy. Papaver somniferum is the name of the plant, which is a member of the Papaveraceae family. As we shall see, opium is a commonly indicated remedy that has many important uses. It's a particularly invaluable remedy for the treatment of both physical and psychological trauma, and it's the main remedy for repressed memories related to that trauma. All right, let's get started.
Opium, along with codeine and morphine, are all classified as opiates. They're natural derivatives of the opium poppy. Heroin is a semi-synthetic opioid derived from morphine. There's a longer list of synthetic pharmaceutical opioids. These opioids include oxycodone, fentanyl, methadone, and others. Both classes of drugs, naturally occurring opiates and synthetic opioids, are considered narcotics. Narcotic is a term that means numbness-inducing or sleep-inducing. To varying degrees, narcotic drugs can dull the senses, relieve pain, and induce sedation. This is why most narcotics are used primarily as painkillers. Opium has a long history as a mind-altering recreational substance that notoriously induces a sleepy, dreamy state of bliss and euphoria. It also has the ability to slow down certain physiological functions. This is why opium was commonly used in the 1800s as a cough suppressant drug. It depresses respiratory activity and blunts the cough reflex. For the same reason, tincture of opium is still used today as a treatment for chronic diarrhea. It slows down the digestive processes. Needless to say, this class of drugs is extremely dangerous to use. Opioid abuse has led to hundreds of thousands of deaths in the U.S. Homeopathic opium, however, comes with practically zero safety concerns, and its therapeutic value is priceless. I want to begin by drawing a diagram that illustrates the spectrum of effects that crude opium can have depending upon the dose administered. This point here in the middle represents the everyday normal waking state. Small doses of crude opium are capable of producing an initial phase of stimulation, followed by a heightening of the senses and a euphoric rush of exhilaration. However, with stronger doses of crude opium, the initial euphoric effect is only temporary. It quickly gives way to a more sustained phase of mental and physiological depression. This stage is characterized by relaxation, mental confusion, sleepiness, and finally, loss of consciousness. Now, we can also use this diagram as an indicator for the therapeutic range of homeopathic opium. Homeopathic opium fits altered states of consciousness that span all the way from alert, excited, and hyperstimulated to confused, sleepy, or unconscious. Okay, now let's talk about the causes or triggers for this spectrum of opium pathology. Just like aconite and arnica, opium is primarily a remedy for ailments from fright, shock, and trauma. Opium fits the effects of both physical and or emotional trauma. It's a remedy for severe trauma. It's a remedy for cases where the effects of trauma have become chronic, remaining long after the original triggering event. This can apply to physical events like car accidents, head injuries, drug overdoses, and strokes. It can apply to psychological events like severe abuse, rape, witnessing an accident, or witnessing an act of violence. Regardless of the specific nature of the trauma, opium is indicated when the shock or fright induced by the traumatic event never fully wears off. Opium is prominently listed in repertories under ailments from fright, ailments from accidents and injuries, and ailments from shock. It's also listed under ailments from excitement, ailments from embarrassment, ailments from mortification, and ailments from shame. We think of opium when these emotional experiences have been particularly dramatic or severe. Opium is the main remedy indicated when the image of the original fright remains in the mind of the traumatized person long after the event has occurred. This can take the form of flashbacks to the original trauma. When a trauma unexpectedly and involuntarily replays in the mind like a movie, opium is our first choice of remedy. Of course, this is one of the hallmark features of PTSD, or post-traumatic stress disorder. Although not all opium cases involve some clearly identifiable trauma, the bottom line is that we think of opium whenever an intense traumatic experience has had a long-term negative impact on someone. Now let's return to our spectrum of opium pathology. Opium's response to these traumas can manifest in either direction along the spectrum, not unlike a fight or flight reaction. On the one hand, the senses can become intensified and the person may become overexcited, easily alarmed, and may have difficulty sleeping. On the other hand, there can be dullness of thinking, drowsiness, confusion, and a lack of normal reaction to emotional and or physical stimuli. In essence, the reaction to trauma can be one of overexcitement, or it can manifest as a strange lack of reaction. Sometimes the two states alternate with each other. Let's examine these two opium states in more detail while keeping in mind that they are both potential responses to severe fright or trauma. On the overexcitement end of the spectrum, opium symptomatology can resemble nux vomica. The mind tends to be sharp and clear, alert and busy. The person may be hurried, intense, and impatient. This state of mind is compatible with workaholic behavior. As it intensifies, it can spill over into an overstimulated state of excitement, manic exhilaration, or euphoria. Think of it as a subconscious coping mechanism. The person springs into action and keeps busy in order to avoid thinking about or dealing with the underlying trauma, which, as we shall see, is often blocked from conscious awareness. This state of excitement can also manifest as anxiety, nervousness, fear, and even alarm. While opium is one of the main remedies for fright, it's interesting to note that it's not listed in the repertory for many specific fears, like fear of dogs or fear of cats. But it is one of the main remedies to think of for those who have been badly frightened in ways that have profoundly altered their lives. While I've seen some patients who manifest their pathology at this end of the spectrum, I've seen a lot more who exhibit symptoms on the other end. A good way to describe the other end of the opium spectrum is that patients become less conscious or less aware of themselves and of physical reality. Good words to describe this opium state are detached and dissociated. The senses are dulled and the person may complain of feeling numb. Think of that classic scenario where an injured person is found walking around at the scene of an accident. His leg is broken, but he feels no pain because he's in a state of shock. This is represented in repertories under says he is well when he is very sick. The two main remedies listed here are arnica and opium. In such cases, the response to trauma is to withdraw from the physical plane, to begin to leave one's body, so to speak. In esoteric terms, one could say that the frightened individual retreats, at least partially, from the material plane onto the ethereal plane. Again, think of this state as the life force's coping mechanism. It's a way by which to escape from unbearable pain or horrific psychological trauma. It's in this state, on the ethereal plane, that a person tends to have surreal experiences, like being out of one's body, or as if floating in the air, or seeing oneself across the room. Opium is the main remedy for out-of-body experiences. It's listed in the repertory under delusion floating in the air. Another characteristic of this detached opium state is numbness and painlessness. Withdrawing from the material plane results in a decreased ability to experience physical sensation. And that's exactly why, when faced with trauma, the vital force may retreat into an opium state. It seeks to protect itself from intense pain and suffering. Recall the guy with the broken leg who feels no pain. The repertory lists this phenomenon under painlessness of complaints that are usually painful. If I suspect opium while taking a case, I will ask the person about their tolerance for pain. Opium typically has a higher pain threshold than most. The opium state of mind can also be one of numbness. He feels nothing, asks for nothing, and complains of nothing. This is explained by the idea that on the ethereal plane, a person can feel unusually calm, placid, at peace, even blissful. I once interviewed an opium patient who recounted a horrific story of chronic childhood abuse. I remember being puzzled by her complete lack of emotion while describing these events. She seemed more than just calm. She was dissociated. This concept can even apply to homeopathic remedies. Opium lists prominently under lack of reaction to remedies. In other words, when well-chosen remedies that appear to fit the case fail to work, we think of a remedy like opium. In some cases, this numbness or lack of reaction can also apply to the moral character of a person. There may be a lack of moral conscience or a diminished sense of right and wrong, with a tendency to be untruthful. Along with morphinum, a remedy made from another opiate drug, opium lists in repertories under liar and inclination to tell lies. Now, on a physiological level, the opium state is one that involves an overall slowing down of the bodily functions. Consider what happens at that moment of fright or shock when you see your life flash before your eyes. Everything comes to a halt, and you momentarily stop breathing. You suck in air and stop breathing for a moment until you can regain your bearings and catch your breath again. At such moments of crisis, people often say that it was like everything happened in slow motion. Reality became distorted, as if it was happening in a dream. Here again, we see how the body begins to leave the physical realm. The life force hovers between the material and ethereal planes, and like in an opium haze, consciousness becomes distorted. Some do recover from this and quickly come back down to earth, but others never fully come back into their bodies. Those who don't wind up with one foot in the material world and one foot in the dream world. They are no longer grounded, and their symptomatology tends to reflect that. There can be mental confusion, drowsiness, or sleepiness. Opium fits people who fall asleep easily or who sleep very heavily. It's one of the main remedies for narcolepsy, a condition that causes a person to suddenly and involuntarily drop off to sleep. It's also a remedy for snoring. But most importantly, people who need opium have a tendency to dream frequently and dream heavily. Very commonly, there's an elaborate dream life with powerful, vivid dreams. Many recall their dreams on a nightly basis. Some have lucid dreams, which is when a person is asleep but is also aware that they're dreaming. To varying degrees, some lucid dreamers have the ability to control what happens in their dreams. A patient once told me that she felt like her mind was more active during sleep than while awake. Some dream so much that when waking in the morning, they sometimes can't tell whether they're awake or still dreaming. Others describe a feeling that they are living life in a dream. Opium lists prominently in the repertory under as if in a dream. Now, normal awareness, mental confusion, and heavy sleep represent varying degrees of consciousness. At the far end of the spectrum, complete loss of consciousness can occur in cases of serious illness or physical trauma. Opium is one of the main remedies for any illness that is accompanied by loss of consciousness. There may be temporary loss of consciousness or persistent loss of consciousness, as in a coma. This can occur during or after strokes, convulsions, or with an infection like meningitis. Whenever there's a history of concussion or head injury during which the person even briefly loses consciousness, we must think of opium. We also think of opium when there is confusion, sleepiness, or even paralysis after a head injury, a convulsion, or a stroke. I've also found that opium is the main remedy in cases of repressed memories associated with severe physical or emotional trauma. This is yet another mechanism that the vital force employs to protect itself from the effects of trauma. It can block painful or terrifying memories from the conscious mind. Many patients describe a vague sense or feeling that something awful happened in their past or their childhood, but they can't quite put their finger on what exactly it was. Forgotten trauma of this nature is far more common than some people think. It's important to understand that while opium can unlock the door to repressed memories, the powerful emotions associated with those memories can feel overwhelming to the patient. While it's definitely a step in the right direction, patients may have their hands full when confronted with the flood of feelings that can emerge. They need the help of someone who can guide them through the experience, someone who will not panic and prescribe another remedy too quickly, and someone who will not recommend psychiatric drugs for the feelings of fear, anxiety, anger, shame, or depression that might ensue. Fortunately, the wisdom of the vital force usually sees to it that this kind of forgotten information is released in manageable bits and pieces. It often slowly emerges in the form of partial memories, body memories, or dreams. In such cases, homeopathic treatment combined with sensible psychological counseling can be an ideal therapeutic combination. Now, recall that there's a tendency for things to slow down at that moment of traumatic crisis. We see this mentally, but we also see this phenomenon reflected in opium's physical pathology, especially when it comes to digestion and respiration. Opium and synthetic opioids are famous for their tendency to cause constipation. Crude opium slows the digestive processes down, oftentimes to a crawl. That's why homeopathic opium is a remedy for severe constipation. especially when the urge to stool is absent. In spite of not passing stool for days, even then, there may be little to no urge to have a bowel movement. If stool is passed, it tends to be in the form of hard, round, black balls. Naturally, this can lead to fecal impaction and obstruction of the bowels. Sometimes there's paralysis of the intestines, or ileus, which is a medical term that means that normal muscle contractions of the intestines have ceased. In fact, post-surgical ileus is a rather common consequence of surgical procedures. If you think about it, a combination of surgical trauma to the body, anesthesia to dull the senses, and painkillers taken afterwards creates the ideal circumstances for an opium state to take hold. That's why nurses are always checking for bowel sounds with their stethoscopes in post-surgical patients. And it's also why doctors won't discharge those patients until bowel activity is confirmed. This kind of severe constipation is commonly accompanied by bloating, abdominal pain, and even vomiting. And lastly, the birth experience is often quite traumatic for infants. That's why we also think of opium for constipation of newborns. Now, opium also has a tendency to slow down or to inhibit respiration. This is why it can be a great remedy in cases of sleep apnea, especially when the person has trouble breathing or stops breathing during sleep or on falling asleep. Such persons may abruptly wake from sleep with a feeling of suffocation. Sometimes there are more subtle breathing issues. The breathing may be slow or uneven or intermittent. I've had more than a few people tell me that there's a hitch in their breathing or that they momentarily forget to breathe. I recall a patient who experienced a rush of adrenaline upon being injected with a dental anesthetic. Immediately thereafter, he noticed that his breathing wasn't normal. This awareness of abnormal breathing continued for months. I almost prescribed hypericum, but I thought twice about it. Opium resolved the problem almost immediately. Okay, now I'd like to briefly mention a few additional situations that can justify a prescription of opium. This includes retention of urine after fright or trauma. It also includes urinary retention of the mother during or after childbirth, in addition to urinary retention in newborns. Opium fits threatened miscarriage from fright and suppressed menses from fright. Note that all these conditions involve the slowing down or interruption of normal physiological functions. A few more opium indications include sudden and dramatic rise in blood pressure, incarcerated or strangulated hernias, and children's health problems that can be traced back to a fright to the mother that occurred during pregnancy. All right, now, there are a handful of opium generals and modalities worth noting. Opium is usually warm-blooded and tends to be aggravated by warmth or heat. Sometimes the bed can feel too hot. There may be flushing of the face and or hot, sweaty skin. Not surprisingly, opium can be aggravated by a variety of emotional triggers, especially fright, fear, anger, and shame. There can be an aggravation during or after sleep. And lastly, there may be an aggravation from alcohol. Okay, now let's finish up with remedy relationships. Complements to opium include alumina, barytocarb, bryonia, phosphorus, and plumbum. Remedies to compare to opium include aconite, which is the other main remedy for severe acute fright. While opium dissociates from fright, aconite's fright is usually accompanied by an intense fear that he is about to die. Arnica is the first remedy that we think of for acute physical trauma, and it also fits that symptom described earlier, when a person says he is well when in fact he is very sick. Nux vomica is constipated, is a workaholic, and is indicated for the bad effects of a variety of drugs and stimulants. Nux moschata is similarly confused, constipated, and prone to narcolepsy. Illumina, too, is confused and constipated and can have retention of urine. Hellebris is also mentally confused, very slow, and indicated in cases of head trauma. And finally, belladonna can have a flushed face and is indicated for sudden spikes in blood pressure. Okay, that's it for opium. As always, I welcome your questions and comments. If you like what you've heard, please tell your friends and colleagues about the All Things Homeopathy channel. And until next time, may the vital force be with you.